All right, we'll go ahead and get started as more people come in. Welcome to our live conversation for our Practice Academy for 2023. This is our second Practice Academy for the year. The theme of our series is Blueprints to the Future, and today our course is focused on bonding and attachment. Really excited to be talking about this topic. Ties in really well with the infant and early childhood mental health field, which is definitely a growing field and things we learn more and more about. So while everyone joins, we're going to go ahead and take a moment to do a poll. This is an anonymous poll. We just want to get an idea of how things are going in your courts and how common this topic is. So let's go ahead and launch that poll. Our poll is, how often are bonding, attachment, and the parent-infant relationship discussed when you're considering family strengths and needs? So if you're in a family treatment court, maybe this is during your staffing, during court, during family team meetings. If you're not part of a family treatment court, think about when your multidisciplinary team is together, looking at treatment needs, those sort of things. So your options are, it doesn't come up. It's not something you look at. Maybe it has come up once or twice, probably in more severe case or when there's something really concerning going on. It comes up occasionally if the family's working with a therapist on these issues, maybe there's services in place and so it comes up. Or our last option is, it's part of our practice. We assess the needs of the parent-child relationship and whether services are needed. So we'll take a moment. Looks about 60% of you have answered. I know some of you are just popping in. I'm also going to share, if you haven't gotten a chance to watch our video yet about bonding and attachment, there's strategies, clinical interventions, sort of some of the basic concepts of this topic. Please make sure to check that out after this event. You don't need to leave and watch it now. This conversation will still be useful. It was playing on loop in the waiting room if you haven't had a chance. It's also on our website, and you've probably seen it many times. We send it through all the emails and whatnot. So please check that out. It's a great lunch and learn option as well. All right, I'm going to go ahead and share the results. So it looks like we've got about 5% saying that these conversations don't come up at all. About 12% saying this comes up once or twice. 23% it comes up occasionally, and about 60% of you are saying it's part of the practice. So that's really, really great to hear. We're excited to hear some of the interventions you all are using and whatnot. So let's go ahead and dive in. So my name is Tessa Richter, and I'm your host for the conversation today. I am a social worker and an LCSW, and my background is in child welfare, and I was also a family treatment court coordinator for a number of years. Children and Family Futures, our mission is on the slide right here. And on the right side of the slide, you can see all of the different projects and initiatives that we have to focus on our mission. So we share this to show you that for the past 25 years, we've had the privilege to work with states, communities, tribes, and regions to collect lessons about what works, and then we get to share that. So this is part of how we do that. So one of our contracts is through the Office of Juvenile Justice and Delinquency Prevention. OJJDP's funded the Family Treatment Court Training and Technical Assistance Program since 2009. And so through this program, we are able to provide training and technical assistance to family treatment court grantees and family treatment courts, even if they aren't grantees, who want to implement or enhance their family treatment courts. We acknowledge OJJDP for this funding and note that the opinions and views shared today are those of the presenters and do not necessarily reflect those of the Department of Justice. We also want to share OJJDP's mission and priorities, which are here on the slide. If you would like more information or to dive into these more, please visit their website for more information. So I shared the theme of this year's Practice Academy is Blueprints to the Future, and this is the second of 2 standalone courses. Our first one was on increasing family treatment court capacity and scale. If you missed that one or you want to use that as a lunch and learn or any of those materials, please check out all of those resources, recordings, links are on the website. You can view through the QR code here, or we can drop that in the chat as well. So today's course is all about bonding and attachment. And of course, attachment is something vital throughout a child and person's lifetime, but this course is specifically talking about parents and their infants aged 1 and under. So how are bonding and attachment different? How can these processes be affected by substance use, mental health, separation? What myths are out there about attachment? What strategies and clinical interventions can we put into place to help parents and their infants? AFCARS from 2021 shared that about 20% of all child welfare removals involved infants under the age of 1, and that's pretty steady from year to year. We know a secure attachment is crucial to the infant's overall well-being, and bonding and attachment can be severely disrupted in families that we serve. There are evidence-based strategies and interventions we can put into place to support the infant-parent relationship, but we can only do that if we know what to look for, we know what exists in our communities, or we know how to start building those. A lot of these topics are covered in the video as well, so again, please check that out. And we also have a policy and practice tips tool that we can put in the chat as well, so please check that out too. We're going to do another poll question, launch our second poll. So we're wondering, especially for all of those who shared that you do talk about these things as part of your regular practice, what evidence-based interventions that focus on strengthening the parent-child relationship quality do you all offer? And you can select all that apply here. I think our poll question might not work though. I think it says single choice. Monica, I don't know if we're able to change that. But if not, we have child-parent psychotherapy, attachment and biobehavioral catch-up, circle of security, promoting first relationships, parent-child interaction therapy, mothering or parenting from the inside out. If there's other ones that you can think of, you can share them in the chat, or we offer some interventions, but I'm not sure which. I see in-home parent support services, that's wonderful. And we have panelists today who can talk about child-parent psychotherapy, attachment and biobehavioral catch-up. So we'll get more into those as well. Public health nursing, Maine Families and Cradle Me, thank you. Chicago Parenting Program, wonderful. So when I introduce our panelists, I'm going to be asking each of them about their why. What is their why for this topic? Why are they so passionate about it? And so I want to share mine. I really believe that the parent-child relationship is where real change can happen. It's how we can see cycles break and see people heal. This relationship can heal at any point, but I do believe it's our job to support parents and infants in those first days in that first year, especially if we're intervening. We need to be able to support them, watch them, and offer interventions as needed. So today we're going to have a facilitated conversation with our panelists based on some of the questions you all submitted during registration for about 40 minutes. Then we'll go to breakout rooms. So this is your opportunity to have more informal conversations with the panelists. So each panelist will be in their own room. You can go to the room that you want. You can bounce around to different rooms to ask different questions. So you feel free to ask questions in the chat or in the Q&A as we go through the facilitated conversation, but also kind of jot those down and think about taking them to the specific breakout rooms as well. We also have a breakout room we call it office hours with a couple of our CFF staff. So if you want to pop in there to ask TA questions about this topic, you're more than welcome to. So again, use the chat box or the Q&A box. When you're in the breakout room, you can mute and unmute yourself, go on off camera. We do ask that you stay muted during this portion since there's a big group. And I know we'll get asked, we will post the recording, the chat box, and all the resources on the Practice Academy webpage after this event. And you can also save the chat box before you leave if you click on the 3 little dots at the bottom of it. One thing, because sometimes folks have to leave before we're done, Marissa, if you will please drop the evaluation link in the chat box. Your evaluations are really important to us, what you thought about the event and also other topics that you would like to learn about. So if you wouldn't mind opening that up now, just having it in your browser. So when the event's over, you can fill that out and not forget. We'll share it again at the end, but in case you do have to leave early, we would really appreciate that. So that'll come through the chat in a moment. All right, we have a really wonderful panel for you all today. Here's their names, titles, locations, but we are going to have them introduce themselves and their work and pop the slides off so you can see their lovely faces. And so I am going to do that now. I'm going to stop my share. We can go ahead and pin our panelists. All right, well, as we do that, I would like to get started with Dr. Elizabeth Bard. And for all of our panelists, as you introduce yourself, please share your name, the type of work you do and where, and tell us your why. What is your why? Why do you do this work? Why do you show up to work every day? Elizabeth?
Hi, well, welcome everyone. I know I can speak for the panelists. We're all excited that you're here and you're interested to learn more. My name is Elizabeth Bard. I'm a licensed psychologist at the University of Oklahoma Health Sciences Center. I'm also an associate professor, and I'm involved in several clinics that help families that have been impacted by substances. So I help direct a program called A Better Chance Clinic for children that have prenatal substance exposure, and we provide developmental assessments and interventions for families. I also supervise treatment through a program that works with mothers who are using substances while pregnant, and it's a high-risk OBGYN clinic at our local children's hospital. And so we provide attachment by behavioral catch-up to the mothers and their newborns after delivery. And then we partner with the Oklahoma Family Treatment Court. And so we work with the Family Treatment Court in Oklahoma County, and we also provide evaluations and evidence-based treatments for these kids. And we currently have 15 families in our Family Treatment Court with 22 children. And so we love being able to partner with them. And then lastly, I'm on the board of our Oklahoma Association of Infant Mental Health. So I love this work. I know for me, when I was getting trained in attachment by behavioral catch-up, I learned about this study where they put heart rate monitors on infants and they were measuring their internal states when a caregiver left the room and re-entered, this Drew study. And even though the kids externally seemed like they were doing fine and they were calm, internally their heart rate monitors were clinically significant. And so I was like, wow, there is a lot of work to be done. And babies are impacted by adverse childhood experiences and by being removed from their parents. And so I stay motivated just because I know that parents want to change. They just need some help finding a different journey for themselves and seeing families heal. And so I just always feel honored to get to be a part of this work.
Thank you so much. Raven Lipford, go to you next. Can you introduce yourself and share your why?
Absolutely. So, hi everyone. My name is Raven Lipford. I am a recent graduate of Case Western Reserve University, class of 2023. I currently serve at Ohio Guidestone as the research coordinator of both the Father's Feeling Study, so paternal depression, and the Maternal Vitality Study, which is a maternal depression intervention in Black perinatal mothers. I think my why for this is I have seen firsthand how parent-infant relationship bonds and attachment are affected by mental health and maternal and paternal depression. And so I'm really, I guess I'm very curious about different innovations and different research studies to figure out how we can kind of bridge the gap between parents who may be struggling with mental illness and adverse relationships with their children. So that's my why. And thank you for having me.
I'm on mute. My first day, guys. Thank you for being here. I really appreciate it. Dr. Marion Silverman, you next, please.
Hi, I'm Dr. Marion Silverman. I'm a licensed psychologist and also the program director at Hope for Youth. The program is involved with Suffolk County Family Treatment Court Focus Program, and what that stands for is Families Overcoming Crises Through Unified Services. That program was created about 5 years ago, and we are still currently doing the work there. This program focuses on parents who have a substance use disorder and also have very young children, ages birth to 6. And what we offer them is an opportunity to work with Hope for Youth, receive child-parent psychotherapy, which focuses on the parent-child relationship, which is something that I feel and really a lot of the people in the court as well, which is very uplifting to know it's not just us therapists, but the judge, the attorneys, they really have come to realize how important that the early parent-child relationship is so important. And my why really was that I've been in the field for many, 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 many years. I used to work in the Bronx. I've seen many children in distress, have experienced tremendous trauma. And then what I also noticed is that it is a multicultural phenomenon where not only is it the children, but the parents and the families. And so it became apparent that we really needed to do something. And the bottom line is I stayed in the Bronx, even though I lived in Long Island, because I thought it was really important work. And I really got tired of commuting, but there really was nothing in Long Island that dealt with early childhood social emotional well-being. And I couldn't get a job. Ultimately, the good news is I was more proactive. I kept looking around. I connected with someone in Nassau County. We were able to figure something out, but then the Suffolk County Family Treatment Court decided that it really is important, and we were able to collaborate with them. So Hope for Youth collaborates with them, and we've been doing it ever since.
Wonderful. Thank you so much. So glad you're here. And last but certainly not least, Dr. Moshe Muller.
Hi, good afternoon or good morning, I guess, depending where you are. My name is Dr. Moshe Muller, and I am a licensed clinical psychologist and at Montefiore Medical Center in the Bronx. And I'm also an assistant professor at Albert Einstein College of Medicine. And I'm also the associate program director for two of our grant-funded programs by the federal government, OFA, and we have a program for couples called Supporting Healthy Relationships. We provide relationship and marriage, parenting education and skills training for low-income families. And we also provide emotional employment supports as well. And we have another program. I'm sorry if you hear that noise. I'm in the Bronx right now, and it's just a classic. Okay, it passed. So we also have another program called Hero Dads, which I'm at that location today. And Hero Dads is also grant funded, and we provide parenting and relationship education to non-custodial dads or dads with partial custody. And we serve a lot of dads who may have been incarcerated or affected by substance use. And we are also partnered with something called the RPG grant, which where it's called Empowering Dads, and we provide those services. And RPG dads all have some type of substance use, either that they themselves or someone in their family has some substance use involvement, and so we provide all those services for them. And then we're involved in multiple studies and local evaluations with all these different programs. Now, why is attachment important to me? Well, part of our couples program, we use something called emotionally focused couples therapy, which is heavily based in attachment theory. And so what we learned from there is that, as I think Marianne was saying, that in the Bronx, we have a lot of trauma. There's a lot of emotional suffering and difficulty in childhood and growing up. And many of our families and our children have experienced insecure attachment with their caregivers due to many different reasons. And so what we always teach our couples who you generally grow up in the Bronx, we teach them that even if you had an insecure attachment growing up, you're able to create a secure attachment with your partner, and that really helps the relationship in a very deep and meaningful way. And so understanding that attachment is not static, it can change and develop over time is very important. And to see that in couples who've gone through so much trauma and things in their past, it's really beautiful to see. So that's my piece. Sorry for the sirens.
Thank you so much. Can't help where you live, right? So thank you, Moshe. That was great. Moshe mentioned the RPG grant, which is the regional partnership grants, and that is something that we provide TA for as well. So I know one of my colleagues just dropped that in the chat. If you would like more information about that grant program and how to apply. So I'm sure, as you all can see, we have a ton of experience, expertise, and diverse interest here with this panel. So I hope you all really take advantage of them being here and check in with them and ask your questions. So we're going to dive into some of our facilitated conversation, again, based on the questions that everyone submitted during the registration. So to start with, attachment and bonding are concepts that get thrown around a lot in our field, sometimes with quite a bit of weight. So I would love for all of our panelists to share, what do you wish the field knew about a bonding and attachment? Maybe there's a myth that you wish to dispel, and would love to really hear your thoughts from that cultural lens as well. How does a person's culture affect their experience of attachment and bonding? And I would love to start with Dr. Silverman.
Sure. What do I wish the field knew? Honestly, there's plenty of people who very well may know this, so I apologize. I'm not assuming they don't. But for me, what I think is very important is that babies really, their early life is so important, and it builds the foundation on how they feel, how they respond towards relationships. They having predictability, having their needs reliably met, a warm, loving, caring person for them helps young children develop a positive attachment, and the feelings associated with that experience really helps them develop their brain patterns and also their physiology that will then later on come into play as they start growing and learning to deal with other people. So I really do believe that what we have early on, without children even realizing, might then experience a response to relationships based on a very early one that they had before. So that's one of the things I hope people know.
Thank you so much. Raven, I'm going to go to you next. Same question, and maybe really from the lens of the mental health work that you're doing.
Absolutely. So I think the biggest thing I wish the field knew, or the biggest myth about, parent relationship bonding, is that dads actually want to be involved. Like, they want to engage. They want to be a part. They want to be a nurturing figure. And in a lot of the work that I do with paternal depression, I hear dads saying all the time, Black dads, white dads, Hispanic dads, that they feel socially ostracized from being able to connect with their children and nurture their children because they aren't women. And that's not necessarily fair. And I think the biggest thing that I've learned is that dads have dreams to love their children. Dads have dreams to nurture and cultivate their children, but they aren't always given the opportunity to. So I think that the biggest myth that I would love for our, work that we do in mental health and parent well-being is to dispel the myth that dads can only engage in a certain way, or they can only engage in a certain capacity, and to really allow them the opportunities to engage with their co-parent in the same way. So that's the myth I would love to dispel.
Thanks, Raven. I would love to do a follow-up question to you. I know you've done a lot of work with Black and Brown families. Do you have thoughts about how a person's culture affects their experience with attachment?
Absolutely. I think that I would say that a lot of the things that we see and how we act in parenthood is passed down. I know that a lot of Black families do have the stigma that dads are not present or dads are not active. And so if that's all you've seen, or if that's all you've heard, that's kind of how you'll act it out. And so I think just finding new language or finding new experiences that dads are involved, that dads want to be involved, is very helpful from a cultural lens as well.
Thanks so much.
Mm-hmm.
Moshe, I'm going to move to you. Same question. I know you do a lot of work with fathers and couples, so I would love your perspective.
Sure, yeah. How's my sound? I put in my headphones so we wouldn't be bothered
Great.
by the busyness of the Bronx. To follow up on what Raven's saying, the myth, and I think I saw something in the chat that someone didn't know that myth about dads. So what's interesting is that John Bowlby, when he created this theory on attachment, he actually created it with just the mother in mind. And it was only until the 80s when a lot of research has or people have noticed that all the parenting research has been involved with the mother and the child and nothing with the father. That's when he expanded his theory to include fathers and other caregivers as well. And so there's a lot of that. It was deep in the research, that myth, or that a lot of it stems from there and from societal expectations or ideas that the dad is not as important, or dad is doesn't know how to do it, or the child doesn't connect to the father. So that's an interesting piece where the research is a bit further behind with men and attachment than with women, with moms and attachment. And I think following up with couples, I mean, couples, no matter what they've been through in the past, I think it's important to realize that they can connect in a secure attachment together with their partner if they're able to, be vulnerable and reach out and be there for each other, the same way that a child is looking for a secure base for their parent when they're in need, when they're hurting, when they're crying, when they need someone to comfort them. The same thing happens with couples when one partner needs some type of support or help. They're able to rely on their partner. The more that they can rely and get that validation and support, the more securely attached they'll become.
Thank you. And I'm curious on your perspective too. What are your thoughts on the cultural lens piece? And I guess a follow-up to that, is there research that you would share about how culture affects attachment experiences or what it might look like?
So yeah, so we work in the South Bronx. We do have a large Black and Brown population, and we also work with a lot of immigrants and Spanish-speaking folks. So about 40% of our couples are Spanish-speaking, and I think of course culture is always going to play a part in how attachment works. I mean, attachment, though, I believe is quite universal. The need for a baby to have some type of secure base. So that part, I don't think is you say that in some cultures attachment's not important. I think attachment is always important, depending how people get there. That I think can vary from culture to culture, but I think it's a universal thing that all babies need to have, and hopefully they develop that over time. I think it also some populations are stand at they start out with more difficulties, challenges, if they didn't have a secure attachment growing up themselves, or they have all these barriers, or they are in they have poverty, there's crime, there's trauma. It can be harder for them, and that is generally with in our population in the South Bronx, a lot of that's what we find. So I think just if you have just a greater community doesn't have as many challenges, I think secure attachment is easier. Not saying it's easy, but you may have less challenges to get there.
Thank you. And Elizabeth, back to that same question. What do you wish the field knew about bonding and attachment, or what myths would you wish to dispel?
Yeah, I was actually thinking the same thing Dr. Silverman stated earlier, just how important those early relationships are and crucial for kids to grow and develop, how they learn about their sense of self, how they learn to regulate. And so how important those early relationships are, not just for attachment, but just how their brain develops and so on. I think that clearly safety is a huge issue and concern. We want to make sure kids are safe if they are in an environment where there's been substance use. But I also think it's important that we consider frequent visitation with families that have had a child removed because of the impact of substances. And I think sometimes we're quick to remove that visitation, and just how important it with safety, if safety's in place, to continue to let that parent bond with their child and help that healthy attachment between them. I think for myths, just that attachment patterns can, some people think, well, maybe they can't be altered, but they can be altered. Parents can read cues of their children. They can increase their bond. They can learn how to be more responsive. I think that we see a lot of parents that come in with their own trauma. And some parents weren't nurtured themselves as children. And so it might not be something that comes naturally to them, but there are some really great interventions out there that can help these parents learn these skills so that they can help develop a healthy relationship with their child. And then one more thing too. I see this often in family treatment court where maybe the parent is not yet at the place in their recovery to have more frequent visitation, and foster parents sometimes are resistant to get involved. And I just feel like attachment work is not only for birth parents, but foster parents as well in child welfare, because they're teaching their child how to have a relationship with somebody, right? And how to signal to a caregiver what they need, which also can promote secure attachment and learning how to regulate. So foster parents can really help lay some of that groundwork.
Thank you so much. I really want to underline that point I heard a couple of you all make about attachment, that it's not a static trait, it is malleable and changeable, and that there's interventions and supports that can do that work. Would anyone want to talk about if or how a child can have multiple attachments to different caregivers? I think, Elizabeth, this kind of goes to what you were just talking about. A child can have a positive relationship with their foster parent and maybe not be super secure with their own parent, but that can change. So can you talk about, I guess I'll start with you, Elizabeth, since you're just talking about that. Can you talk about that interaction a little bit? And I think, again, that's kind of a myth that happens a lot, that if a child is bonded, or securely attached with their foster parent, that means that they won't have a secure attachment with their own parent. So I'd love to hear your thoughts on that.
Right. I mean, we want children to have secure attachments, period. And, as you mentioned, this is how we know it impacts child development and growth through relationships. And so if we can make that relationship more secure between the foster parent, that's wonderful. That's going to help their overall development. And then usually what we'll try to do is when the birth parent is in a place where they're able to see their child more, we want to include the birth parent and the parent in getting involved in the treatment as well, to then begin to work on their attachment too. And so it can be really nice if the foster parent is able to bridge with the birth parent and really work on coming together and helping that parent be able to help foster that attachment.
Does anyone else want to discuss that about attachment networks, anything working with foster parents and the parents? Mary?
Yeah, I'd like to, because it's an issue that comes up all the time. Clearly, we all know that, well, I shouldn't say that, but children can form multiple attachments. And in treatment court, we want them to, because if they can't be with their biological parent, it really still is a very important feature. And what we see, though, is there are a lot of biological parents who struggle with that, seeing the other person caring for their child, knowing that they're not the one, and really working on having them be able to tolerate that, understanding that you want your child to be able to attach, because it will be a very positive strength for them later on. So I definitely think it's something that comes up a lot.
Sure. Someone just put in the chat too, a similar experience about a youth who's concerned about the foster parent creating a stronger bond with her baby than she's able to, or she's able to, yeah. Thanks, Marian. Anyone else want to address this topic, or should we? All right. Let's move on to our second question. So, we covered attachment and bonding and the importance and what it does for kids, how it's malleable. The families we work with have a lot of significant disruptions that can affect attachment. So substance use, mental health challenges, separation, incarceration, prenatal substance exposure. There are a couple questions in the registration about that. Child welfare involvement in general can really affect the parent-child relationship. I would love for you all to talk about how it affects that relationship. And then what would you encourage teams to look for, professionals to look for as maybe a signal or a flag that the relationship needs some support through some interventions? I am going to start, can't remember where I started with last time, so I'm going to start with Raven on this one. Are you having tech issues, Raven? Oh, there you are.
No, I'm good.
Perfect, thank you.
Yeah, I think this is an awesome question. I think one of the ways or one of the flags that mental health workers or, social health workers can look for the flag is really isolation between the parents and different interactions with their children. So I feel like a lot of the work that we do tries to bridge the gap between parents and healthy interactions with their child. So anytime that you aren't really seeing those interactions or seeing those interactions in a positive or healthy way, it could be a flag that something has gone awry.
Is there anything you've seen in your work with the depression studies that you see as a flag that it might affect the parent's relationship with the baby?
I think not being granted access to help the children in the same way as their co-parent. Maybe sometimes I see that in the different, co-parent dyads. Sometimes dads are barred from interacting with children in a healthy way or in a fair and equitable way. And when that happens, it usually has, adverse effects on the child. So that's just something I've seen. Dads not being able to interact in the same way.
Elizabeth, I'm going to go to you. And I'm wondering if you can specifically address that prenatal substance exposure piece and how that can affect attachment.
Yeah, well, we know that kids with prenatal substance exposure, they're more at risk for development and emotional, social, behavioral problems. And so when there's mental health challenges on both the child side and the parent side, we know that can impact the relationship. It can impact their attunement with each other. So if the infant's difficult to soothe or often gets dysregulated, we know that can cause impairments in that parent-child relationship. So some parents may take it personally if their child is not easy to soothe. So my child doesn't like me, or my child doesn't want to be with me, or feelings of guilt. We've heard a lot of parents wonder, did I hurt my baby? Are they acting this way because I was using substances while I was pregnant? They might feel less confident in their ability to parent and might cause avoidance of interacting with their child. And so really just working on giving that parent the strength that they need, giving them tools, building them up so that they feel like they can do this, giving them good education on child development is really important too. And I think that gives the parents confidence to be able to feel like they can do this. We see also a lot of families that are in recovery have limited outside support. And so usually for the provider or the people involved in their case is their support. And so helping them learn to trust the provider, that you have their best interest. And also usually it's not just the intervention they're needing, but also resources too, to help get them to a place where they don't have a lot of these other additional barriers, and they can just focus on what they need to do to parent their child. So I think sometimes the signals they need help, or just hearing some of those internal barriers I talked about, like if the parent is thinking, I can't do this, or my child just doesn't want to be with me, or they don't like me, or the parent's not responding to those cues, those to us or a signal that they need some additional help.
Thank you so much. I hear some of the maybe lower hanging fruit that you're talking about is just along those like normalize and validate and reach out. Like here, it's okay. I mean, I think all parents need to hear that. You might not feel that strong relationship with a baby on day one, and that's okay. And normalizing and validating some of that.
Yes, absolutely.
Thank you. Moshe, same question to you, please.
Sure. So I'm going to focus more on the, what these barriers may do to, may impact the attachment. Something like, substance use or incarceration, child welfare, separation. So with attachment, you really need to have consistency and constancy. And when you remove a parent or there's something that's getting disrupted, um, the parent is probably going to be less consistent. And when that happens, the child may get confused, may not know who to turn to. They really need to have that consistency. And so I think that's a major factor when other things are happening in their lives that are, hold these challenges. It can impact attachment for sure. Maybe some red flag to look for. I mean, sometimes when you see parents interacting with their kids, maybe in the waiting room, or how responsive are the parents? How attuned are they to their children? Are they do they provide validation? Are they providing support? Do they ignore the child? Are they consistent? Are they inconsistent? How do they respond? And so if we see that parents are attuned, and maybe whether it's providing, some limits with some validation, great. But if they're not, that may be a sign. If you see it a few times, there's some work to be done.
Thank you. And Marian, same question to you.
Sure. So in the focus program, which is the, family treatment court, almost all of the parents we see describe very similar feelings and emotions. They really do worry that their baby is not going to know that they're the parent. They worry that they're going to forget them. They feel sadness. They feel, not connected. And a lot of the times they feel shame and guilt, especially if a parent used during their pregnancy. We have so often heard a parent worry about the impact of their use on their child. And they also feel like they're being judged. And we have many parents say, I don't want anyone to know. I already know they look at me like a bad parent. So those are some of the things that the people we work with bring to the table. And we know we have to sort of address those kinds of concerns. As far as needing help and some of the signs, I mean, there is, of course, the obvious one, which is that a baby's crying and the parent isn't responding. And I think that is something that people often are struck by. I think that if a parent says, I don't want to pick them up, I don't want to spoil them, that is not just their feeling, but it also may be what they themselves have been told. So there is a multi-generational culture of, I'm not picking up my baby, and this idea that you spoil a baby. And the other thing is that, which has really been talked about a lot, negative maternal attributions, which there's an article, there's quite a few articles, which is really when the parent is describing something that is a regular activity, but in a negative type of way. So for even example, a baby who is really drinking down a bottle and is very hungry, one parent might say, oh, you're so hungry. I'm so glad that you're eating. I hope you feel like you're getting full. Whereas sometimes we've heard, the negative attributions, which is my child's so greedy. And again, I think a lot of the times it's this internal model that the parent has from many, many generations of being told this is the way you're supposed to do it. Their models aren't always the ones that are going to promote that attachment and the way that we look at it. So I know, again, that is important to address.
Those are great examples. At the beginning of your answer, you talked about how parents feel the shame and guilt and the stigma and all of these things. How do you see that affecting their engagement in the family treatment court and in treatment?
Well, I mean, one of my examples would be that I have a parent who used, and she's, loves her baby so much and engages with the baby very positively. But sometimes during our session, she suddenly is so happy, but then she starts to cry, or she starts to have a very negative affect that's very noticeable. And it somehow disrupts this wonderful moment. And obviously it's on her mind. So it's an opportunity for me to ask, you're crying, what is that about? And it's an opportunity for her to speak out loud about that guilt and be able to process it. Of course, we understand her feelings, and being able to really address the here and now, and look at what you can do now, and address the guilt and what happened before. We have to say sometimes, which often is the case, many parents feel they didn't do what they needed to do. And it's being able to say, well, you were using, I mean, really very, very directly, you were using, and you were not really able to be the parent that you wanted to be. Because while you're using, the most important thing is that. And no matter what you love, no matter what is important, no matter your health, those things get pushed aside. Helping them understand that it wasn't by choice necessarily, but if they're in the midst of using, they really are very connected to that more than they are to their very loved child.
Thank you so much. So we have about 10 minutes left in this section and 2 great questions left to answer. So what I'll let each panelist, if you guys want to decide if you want to discuss strategies and interventions, or if you want to tell a story. So Moshe, I'm going to start with you. If you want to either share a story that has really stuck with you about providing infant-parent relationship support, or you could share with us about strategies and interventions that teams can put into place.
Sure. I'll go with the strategies and interventions. I do have a story, but if I have to choose for now, it's actually a story with my daughter. But so at Hero Dads, we have a lot of our dads have insecure attachments. They have so many things that have gone on in their lives, and that further increase that insecure attachment. But they also have a low level of trust in systems and in programs in general. We create our program very differently than what they're used to. For example, when we bring them in for their initial assessment or intake, we sit next to them as opposed to sitting across from them. It's a very different approach from that they're used to. We're trying to change that their negative impressions or their cynicism about this type of work. And that's just one of the things. The goal actually in our program is to create a secure attachment to the program. That's one of the way that we model our program, is that they can eventually form a bond with the program. They can feel like they can come to us as a secure base to get whatever they need, jobs, financial support, clothing for their babies, diapers, just being with other dads. So ultimately, they learn that they can rely on us and that we are very different from their previous relationships with other institutions. And in the beginning, they come with like a hard shell on, and slowly that breaks down. They're able to be vulnerable and share with others, and they create this bond together with other brothers and with the program. And that in the end of the day, we teach also about attachment as part of our curriculum. But we show also how the same way that they're able to, create this secure bond, this attachment with us as a program, we say that they can also do this with their children, and we help them. So that really helps us. That's how we sort of extend the model for them to be with their children, and we've had some success with that.
Thank you. It sounds like so much of this distills down to relationships and connection, and our relationships with the people we work with their relationships with each other and their children. Moshe, I encourage you to tell your story maybe at the beginning of your breakout room. I think that'd be a great way to circle back. Elizabeth.
Hi. I think I'm going to talk about the intervention that we use for our family treatment court, and also the program where we're working with mothers who are from the high-risk OBGYN clinic. We use attachment by behavioral catch-up model, and it was developed by Mary Dozier, Dr. Mary Dozier at the University of Delaware. And she saw that kids that have experienced an adversity were more at risk down the road for behavioral, social, emotional concerns. So she developed this short-term treatment to help target some of these areas to reduce these from developing as kids mature and grow. So it's attachment-based treatment. It's home-based. So we call ourselves parent coaches. We come into the home with the parent, and as they're playing with their child, we're giving psychoeducation on teaching the mother or father or grandparent or whoever we're working with, the whole family, about how to provide that nurturance as they're playing with their child, helping them learn how to read their infant's cues. There's also a treatment for newborns too that actually starts in the parent's third trimester, which is what we're implementing in Oklahoma too. So teaching these parents how to read their child's cues, how to nurture them, how to follow the lead. So we know that serve and return is really helpful. When the child does something, the parent's going to respond. So teaching parents how to do that. We also talk about how to delight with your child when they're playing and interacting with their baby, how to reduce intrusive behaviors. There's even sometimes spin on what we call voices from the past. So voices that they've heard from their own childhood or their past that might interfere again in the way of how they're parenting. And as I mentioned, it's a great intervention, great prevention, and we recommend all the families in our Oklahoma County Family Treatment Court go through that. And we found it really successful in helping parents attach with their babies. Thank you.
Thank you. So many great follow-up questions, I'm sure, to a lot of these. There's more information about these interventions. So maybe our panelists, if you want to drop things in the chat or share things in your breakout rooms for people who want to follow up. And then there's also more information about them in the tool as well. Marian, on to you.
Sorry, a little technical problem. I can easily talk about both because they're very intertwined, so it will be, kind of meshed together. But what we provide all the therapists in child parent psychotherapy, we look at ports of entry. We look at opportunities that arise naturally in a session or from what a parent says that allows us to explore their their history and some of what they've been through, sort of what happened before when the parent starts crying, tell me about why you're crying, a port of entry. And it's very important that, you know, you keep that in mind. And there's always you might miss one or two or three, but there's always something. And if you just keep in mind, there's an opportunity to learn more, is a way to connect with the parent and understand how they're going to interact with their child. And then also benign explanations, especially in supervision. I meet with the therapists, and, you know, there's a lot of things parents do and have opportunities that they might do something that we just don't agree with, and it's really being able to think about it in a different way. And a benign explanation, well, the parent might have used again just before they were getting their child back because they felt so much stress and were so worried about being the parent that they wanted to be. And so there's always a way to provide that kind of interaction. And the parent that I was talking about before, she now just got, you know, unlimited overnight. You know, she's really well on her way, and she's able to really explore how her own experiences influence how she parents. There's an article called Ghosts in the Nursery. I feel like many people know it. And it is about how when you have a child, especially if you've had a very difficult upbringing, it will kind of be there when you have a baby, and it can interfere. What I have found with every parent, including myself, it happens anyway. You know, where I'm like, I don't want that to be, because I remember what it was like for me.
Thank you so much. Last but not least, Raven.
Yes. So I think, speaking from like an intervention and strategy perspective, I think one of the main things that I love about the work that I do at Ohio Guidestone is it's so applicative. Like, it's so based on the lived experience of these families. And I think one of the main things that we do that I love are what we call longitudinal interviews. And so we will meet with these dads who have participated in our study either like a year or two later, and we get their perspective on how everything went. Like, we know the research behind it, we know the science behind it, but we want to know, is this in real time like helping you? Is this in real time helping your family? Is this in real time helping your attachment with your child? And most of the time we see that it does. And so I think if I could encourage anything, it would be allow the parents who you're working with, or allow the families who you're working with, to have a voice in these different protocols or in these different therapy treatments. Let them have a voice. So, yeah.
Thank you so much.
Mm-hmm.
All right, that was a lot of information. I know there's some really wonderful questions in the chat that are not easy to answer, which is great. So we're going to start moving into our breakout room portion. So let me share my screen again. Switch. Switch again, sorry. All right. So for our breakout rooms, in a moment, a box should pop up with the different breakout rooms with each of the panelists. So we'd like all of you to select which room you want to go to. Again, you are more than welcome to move around. We'll have 20-25 minutes in the breakout rooms. Our panelists, if you want to start by sharing the story that you had prepared, you are more than welcome to do that. Just a reminder, all participants, these are informal. There is a Children and Family Futures facilitator in there, but please put your questions in the chat, raise your hand through the Zoom options, or you can come off mute and ask your questions. Really hope you make the best use of your time. If you are on the phone, sometimes it's really hard to move, so just stay in the breakout room, or I'm sorry, stay in the main room, and we can help move you to the room you would like. Or if you're just having a hard time moving, we can do that as well. If for some reason the box does not pop up, if you go to the bottom of your screen where the Zoom toolbar is, there should be one that says breakout rooms, or you might have to click on the 3 dots, and then you can select breakout rooms there, and then it'll pop up and you can click which room to join. You'll see a countdown once it's time to come back. And here, just some suggestions of the focus for each breakout room if you want some help figuring out where to move to. So we're going to go ahead and open the breakout rooms. Our panelists will move into those rooms, and we will see you all back here about 20 after the hour. The rooms are... Welcome back. The room should be closing. I think people will be slowly popping in. Try to get our panelists back up here. Perfect. Well, I got a moment to join each of the breakout rooms. You guys were all having really amazing conversations. Sounds like there's just so much passion about this topic, expertise, interest. So I really appreciate everyone being here. Our panelists, our participants, everyone, for talking about this topic. I would love for you all to drop in the chat, all of our participants, something that you learned, something you took away, something you would like to start implementing, reading. And I heard a lot of book recommendations, training recommendations, those sort of things. So please drop in the chat what you learned and what you're going to take away. And as we do that, our panelists and close out, I would love for each of you, and the question we always ask panelists at the end of our Practice Academy, in 1 or 2 sentences, what advice do you have for professionals or teams or our peer support, anybody who wants to do this work? And I will go backwards from where we started. So Moshe, would you start, please?
So I think I think the idea is to remember that there is a lot of hope in the work that we're doing. Children are resilient, and as we said, attachment is malleable. And I think that if we're able to help strengthen attachments in families, you'll be doing a lot of good work. You may not see it right now, but attachment is something that is a pervasive type of it's an important piece of development overall, and even into adulthood and intimate relationships. So I think there's a lot of hope to instill for all of you. That's my thing.
Thank you so much. Marion, your advice.
I think my advice is to support each other. I think the work we do, our work in focus is very, very difficult. We've had a lot of success, and we've had a lot of instances where, we have really had to be there for each other, unfortunately. So I do feel that you need to use each other and talk about your cases with your colleagues whenever you can, that you work with, because you do need to decompress and know that there really is vicarious trauma sometimes. And there's in my training in CPP, my CPP trainer had given this great video. And it's about vicarious trauma, and it's kind of presented by a comedian. I'm going to look for it, and I'll put it in the chat.
Thank you. Raven, your advice.
I think my advice would be, and it's actually kind of funny because my boss and I talk about this all the time, and I'm kind of stealing it from something she tells me all the time, is don't be afraid to necessarily practice what you preach, is what she would always tell me. I think that the work that we do with mental health in families is so broad and it's so big, and we're always encouraging others to take care of themselves and take care of their families. But I feel like sometimes we lack doing that for ourselves. And so my advice would just be everything that you do to serve others and educate others and teach others to be healthy, don't forget to do that for yourself and your family. So yeah.
Thanks, Raven. And what you said and what Marion said reminds me, for folks who aren't really involved in the infant mental health field, reflective supervision is a huge piece of that work, which I think really ties into what they're saying. So finding out how things are making you feel, what your own experiences and how you're interacting with people because of that. So definitely something to look into if that's not something you've heard of before. Elizabeth, would you finish us off?
Yeah, all good things. I was just to add what Dr. Mueller was saying too, just how resilient families are. And also just to keep in mind that you also have an impact on families. And so, just asking yourself too, do you have hope for this family, right? These things are important. Do you believe this person can change? All the things that you bring into work make a huge difference. And so I think it's important to ask ourselves these questions because your attitude and beliefs about the family make a big difference as well.
I love that. Thank you so much. Thank you to our panelists. You are all amazing and doing fantastic work. And I know our audience really benefited from you all being here. Before we finish up, I'm going to share a couple resources. Let's see if I can get the right one. All right. So if some of these concepts seemed, maybe they're newer to you or whatnot, or if you just want to get back to the basics, please check out the video that we have. We're going to drop all these in the chat again. Everything is on our Practice Academy website. It should be pretty easy for you to find. Well, we have the links, but the video goes through a lot of what we talked about, sort of giving some of those basic concepts, the difference between attachment and bonding. It talks about some of the interventions. We also have a tool, a practice and policy tool that goes through some of those basics, talks about barriers to bonding and attachment, some of the risk factors. It has links for some of the interventions we talked about, ABC. I saw a lot of people interested in that, CPP. And then there's also a policy section. So you think one of these interventions would be great or support strategies would be great. Well, how are you going to fund it? So we have some really great resources on that as well. And as always, we're available for ongoing TA. If you have questions about this after you read some of this, do this with your team, review these things. We're here for that. On November 16th, the final part of our course, we have a peer-to-peer idea exchange focused on this topic. Hopefully some of our panelists will be able to join us too, but that one is continue to be a fairly informal conversation. It's 1 hour long on Zoom, and we just share questions about the topic, what other folks are doing around this, other interventions, those sort of things. So please include that on your calendar and register. And lastly, there are a ton of resources on the Practice Academy website under this topic. If you go on the far right tab, it says materials and TA resources. There's some resources that our panelists provided. There's some great research articles, some other Practice Academy courses that are recorded that are related to this. So definitely check out all those resources as well. Our first course from July is on the website. All recordings and materials are available, and keep watch out for our next 2024 courses. We'll be announcing those in the coming months. Again, please take a moment to complete our training evaluation survey. It shouldn't take more than 4 minutes maybe, and give us your thoughts on how this went and any future topic ideas. Make sure you've joined our listservs. We have a Children and Family Futures listserv. We have a Family Treatment Court TTA listserv. Here's a QR code for our website as well. So if you want to do those, contact us for TA, any questions or thoughts. And lastly, we are going to be dropping a certificate of attendance into the chat. So you will need to download that from the chat box. If you have any problems, you can also email us at this website. We'll stay on for a couple minutes, but otherwise, thank you all so much for joining us. Thank you to our panelists for their time and expertise. This was just a really, really wonderful hour and a half. So thank you all for being here, and we'll see you next time.